I'm Denis Rancourt. I'm a former tenured full professor of physics, and one of my main research areas has been nanoparticles in the environment and how they grow, how they're formed, and all the various ways that they can occur and their importance in environmental processes. So I know about small particles, and on April 11th, I wrote an article that I uploaded to ResearchGate, which is entitled Masks Don't Work, a review of science relevant to COVID-19 social policy regarding masks. That article has been very popular. It's being read quite a lot on ResearchGate, and I want to tell you about it. I reviewed the medical literature, which is the randomized controlled trials about whether or not masks work, and also the meta-analysis studies of all these controlled trials, and just all the studies that have been done on whether or not wearing a mask or a ventilator can help prevent you getting a viral respiratory disease. And what I found in reviewing all of that, and the article is in a link in the description of this video, is that it's demonstrated that there is no benefit whatsoever to wearing a mask or a ventilator. Typically nurses and healthcare workers get headaches from having to wear these ventilators because they restrict their breathing. And it's been shown that the healthcare workers do not get do not have a lower risk of getting the flu, for example, during a flu season and so on, even though they're seeing a lot of patients. So there's no advantage to these masks that's been demonstrated in any of the literature that has looked at community applications of masks and healthcare applications of masks. And there's been a lot of studies and meta-analyses and so on. There is no evidence that it can be of any use in terms of preventing being infected. The other thing I looked at in this article, which I hope you will look at, the article, as I said, is entitled Masks Don't Work. This is what it looks like. Okay, and it's been read quite a lot there on ResearchGate. And the other thing I did in this article is to review the physics and biology of how masks should work if they were to work. And this involves blocking aerosol particles and large droplets that can be in the air that you would otherwise breathe in. So typically these diseases transmit very effectively because the transmission depends on tiny aerosol particles, typically smaller than 2.5 micrometers, that are well carried by the air and do not gravitationally, they're not gravitationally drawn out by the air. And so the masks don't prevent them coming into you. And in addition to that, I reviewed the science that one such droplet carries the minimum infective dose for a typical disease of this type. So that means that masks are not going to work, because as soon as you have the slightest little pore in the mask that's larger than the nominal value of the manufacturers, and so the air will be drawn in that way. Or if you're not wearing the mask perfectly correctly and it's not stuck to your skin at all times, that's where the air will most easily flow with the greatest speed, and all the particles will be drawn in that way. So it's not going to work from a purely physical point of view, and a single droplet's enough to give you the infection, studies have shown. So they don't work. And the other thing I did in this paper is to point out all the potential dangers of masks that have not been studied or considered, really. This includes, that the mask is collecting these pathogen-laden particles near your face, and to what extent can the bigger droplets be broken down, vaporized, and you breathe them in later, even if they're initially stopped by the mask? To what extent is your breathing out? Let's say you breathe in partially, it doesn't go into your lung, you breathe it out, it's captured on the mask, and then you would retake it later. All these kinds of effects of delayed intake from the fact that you're wearing a mask have not been studied. It's unknown. What are the long-term health liabilities for healthcare workers if they're forced to wear masks and have their breathing restricted all this time when they're working. You know, it's been documented that they much more frequently get headaches. What are potentially other health negative health consequences for these workers? Are there negative social consequences to having a lot of people in the society wearing masks? I mean, we're social beings, we're used to seeing each other's faces. What happens if everyone's wearing a mask for a lot of the time for an entire season, or get into the habit of always wearing masks? How does that change our society? That's not been studied, it's not been looked at. And the other important factor is, how does it affect your personal psychology to wear a mask? And I'm going to be looking at that and the studies that are relevant to that in a next video. So for now, I just want to leave you with the message that this article is out there for you to read. It covers all the scientific research, and it concludes masks do not work.